So, welcome. Welcome to this little call. Welcome to you all and to our speakers, Celeste Thirlwell and Jaan Reitav. I'm Ayuna Pedersen, and I'm the host. I'm a body and trauma-oriented psychotherapist that are situated here in Denmark, Copenhagen. And in the call, as I can see it right now, you all know me, but maybe there would be someone to listen later on that do not. I met Celeste and Jaan in Canada while we were doing a training in deep brain reorienting. And there you told me about your work about sleep and about the book that you have written and now is published by Norton. Dr. Celeste Thirlwell, you are a doctor in humanitarian services, and you have a huge background in sleep medicine and in psychiatry and in neurosurgery and in neuroscience research. And you have worked globally with refugees and veterans and first responders for over a decade or more. And you are also a medical cannabis expert in the treatment of sleep and pain and PTSD. And
Yes.
you, Jaan, is that right? Is it?
Yeah. Thank you.
I could say so much about both of you, so it's like, poof. And Jaan Reitav, you are a licensed psychologist in Ontario, Canada, and you have worked for over 40 years on understanding and restoring the healing functions of sleep. And so many things. I don't know really what I should pick of all the things you've done. What I can say is that you also have developed a Better You, a group program for mind-body stress management that integrates CBT insomnia. Yeah. And I don't know, Jaan, if you like me to say more that is important for you.
I think that covers the important points.
Yeah.
Sleep is my love.
Yeah, sleep is your love. Both of you have written this, Putting Trauma to Sleep. Oh, this one. And you have digged into addressing the autonomic nervous system's dysregulation and linking sleep disturbances with vulnerability to trauma and chronic illnesses. Yeah. And with that said, Jaan and Celeste, please, the word is yours. Welcome from my heart to you, all the way from Canada.
Thank you. Thank you so much, Ayuna. It is so exciting to be here and to meet with colleagues across the pond, as they say. So Celeste and I are going to walk us through some slides. Our hope is to give you a sense of how this book may be of help to you in the practice that you have. Before we begin with the presentation, we're going to take a couple of minutes just to first do some breathing. So I think one of the really important things is to kind of clear one's mind and be able to focus on what you are just about to do. So I'm going to walk you through just a guided kind of centering exercise. So I'm going to have everyone just notice that you are sitting and being held by a chair. Could be a sofa, could be a couch, could be a working chair. But just take a moment to relax into it. Just allow your body to be limp and allow the chair to support you. And as you allow your body to relax fully, we're going to focus on our breath. So we're going to breathe in nice and slowly through the nose, taking a really nice, slow breath of air, filling the lungs, feeling them expand. And then we're going to pause for a second. And for the exhale, you can purse your lips, make a small opening, and just blow the air out through that small opening. And as you blow the air out through that small opening, making that sound, you should begin to notice your belly tightening as it's pushing the air out. And once you get to the end of the exhale, just pausing for a second again, and then allowing the next in-breath to just happen as mindfully as you can. So we're just going to take, about a minute just to get into that rhythm of breathing in through the nose, pausing, exhaling through pursed lips, nice and slowly, allowing the air to enter and exit the lungs. And with each breath in, just imagine yourself bringing in energy from the universe, energy that's going to energize you, to help you focus your thoughts on all of what we're going to be talking about today. And as you exhale through pursed lips, just imagine any stress that you've been under earlier today. Just imagine all of that stress leaving your body. And just enjoying the rhythm of breathing in and breathing out. No rush, no hurry. So with that as a start and relaxing you and calming you, we're now going to ask you just to bring back to your awareness any work that you've been doing with patients or clients where the client tells you that they can't sleep or tells you they feel fatigued or complains they have no energy, they can't get things done. And as you remember some of these interactions that you've had with either past or present clients, I want you to reflect on, how do you respond? What do you say? What kinds of ways do you have of working with these people who are struggling? They're struggling in many ways. But when they bring up the topic of sleep and energy and fatigue, what are the tools that you already know and are aware of? And so from this place of knowing what you're already aware of, we're going to begin with our presentation. We're going to talk about a couple of things. So I'm going to first share my slides. So just click here, and share. And so what our book is putting together for you as therapists is information that we hope will be helpful in managing and working with all of the different clients that you see. And the subtext for this presentation today is bridging the gap between sleep science and trauma therapy. So you are the trauma therapists. What we want to cover in the next 30 minutes is, first of all, why would you care about learning more about sleep? Because, as you well know, learning any set of skills takes time and effort. So why would you want to put time and effort into this? Then we could talk a little bit about how the book can help you in dealing with those clients that come in complaining about poor sleep or no sleep. And then towards the end, we'll talk a little bit about what you can do if you're interested and keen on learning more about these things. What are some of the choices that you have? So with that, let's begin. So if you're trauma therapists, then all of you, I'm sure, would already be doing these three things. And that is managing and resolving traumatic experiences for people that come in to see you, dealing with attachment wounding, which is very common among these patients, and also dealing with body symptoms of different kinds, whether it's pain, whether it's other medical conditions. So in that sense, you're already a TAB trauma therapist. So why add the S? Well, I would say the one thing is that it makes your treatment, it multiplies the effect of your treatment. And I'm going to try and explain how it multiplies the effect. And so if we look at sleep, in this diagram here, we see what the brain does, what the mind does for you when you fall asleep. And what you see here are a series of white bars. If you look at the diagram from the left to the right, this is the sleeping brain. And the white bars are called A1 subtypes, which is a cyclical alternating pattern that tells us that the brain is beginning to communicate within itself. So now the external cues of what you're hearing and seeing, and all the other sensations that come with, your waking life, all of those have been turned off. And what does the brain do? It starts a conversation between the thalamus and the cortex. Um, and so many messages start to be moving back and forth. And so the A1 subtypes, as you can see across the night, begin to be diminished with time. And the other thing that shows up are the black vertical lines, which are called A2 and A3 subtypes. And these are an indication that there's some motor activity, right? Your brain is starting to want to do something. And also that it's activating your autonomic system, which basically means all of your feelings and activation of heart rate and breathing and all of that. And those cycles occur just before you go into rapid eye movement sleep. So it kind of prepares the brain for rapid eye movement sleep. And down below those bars, you see what's called a histogram. That's basically telling us what phase of sleep you are in. So I'm going to just expand that so you can see it a little clearer. And what you see across the night is that your brain activity starts with being very alert when you're awake, and then it kind of drops down into a low level of sleep, a middle level, and a deep level of sleep. And it does that for about an hour and a half. And then it goes up to what's called the rapid eye movement sleep and does that for 5 or 10 minutes. And then you see a second cycle of the same kind. I'm going to see if I can get my pointer working here. It might be easier to show what I'm doing. So here's the awake brain. Here's kind of a mild, very light sleep, then a medium sleep, and then the deep sleep, which is when your brain is activating your dopamine system. It's remembering things that happened during the day. Your short-term memory is reactivated, and it's moving those memories up to your long-term memory, up in the cortex. And then once it's moved up into the cortex, the rapid eye movement phase is where your brain starts figuring out, where does this new memory belong? How do I integrate it with what I already know? And then after that first 90-minute cycle, you see there's a second one, and then there's a third one, and so on through the night. And so the brain is doing this dance between recalling memories that have some emotional significance and then putting them away, learning from what you did during the day. And so that dance back and forth between non-REM sleep, slow wave sleep, and REM sleep is what keeps us functional. And at the bottom of the slide, I put up a quote. This is from an article that was published virtually the same day as our book came out. And in that review of, I think, 27 studies of sleep in adolescents and young adults, the conclusion the authors came up with was that evidence suggests that improving sleep through targeted interventions can significantly improve emotional processing and treatment outcomes in PTSD patients. And that is the reason why we think it's important for you to, oh, to yeah, important for you to think about adding to your toolbox, adding skills in managing sleep problems. So how does normal sleep work? Well, it works basically when the circadian um, oscillation between light of daytime and dark of night is registered. It's registered by the suprachiasmatic nucleus, and that tells the part of the hypothalamus called the ventrolateral preoptic area, the VLPO. That tells that area nighttime has arrived, let's get us to sleep. It also tells the paraventricular nuclei to release melatonin. And melatonin, sometimes called the darkness hormone, basically tells the body to slow down. Okay? It doesn't put you to sleep, it just tells it to slow down. We're going into sleep. And the VLPO tells all of these structures in the brainstem. All of these are responsible for keeping you awake, keeping you alert. It calms them down. It inhibits them. So you can see all of these structures are quieted by the VLPO. And that is what allows sleep to happen. And that is what allows what I was showing you in terms of the dance between non-REM and REM to happen. And Celeste, do you want to tell them a little bit about what happens in that magical sleep period then when that is working well?
So I really look at the sleep period and all those stages, stage 1, stage 2, then non-REM sleep, which is stage 3, stage 4, or deep sleep, and REM sleep, all integral to recharging the body, mind, and even, if you want to say, soul of the person, so they're ready for the next day. And when sleep gets dysfunctional in any way, the person is not able to recharge, so they have less energy during the day. The cells don't regenerate as well. There's not the release of the human growth hormone that is needed for tissue repair. We also know with fragmented sleep, even the packaging of the lipid bilayer, the membrane of the cells, doesn't get properly done. So the cells, which are the factories of your body, can't work properly if that lipid bilayer cell membrane is not packaged properly. The other thing that happens is there's a lot of detoxification that happens with proper sleep. So our brain is detoxing the free radicals, glycemic clearance. This is very important. Memory consolidation, as Jaan referred to, we know we need to replay those memories in the slow wave sleep. And then really REM, you can look at REM as defragging a computer. You're defragging the stuff, you're putting the short-term memory and intense emotions, you're digesting them, you're putting them in long-term memory so they don't stay active as circuits the next day and you can continue onwards. We know with trauma, those trauma circuits stay active and continue being triggered again throughout a lifetime. So this is why sleep is so important. And there's research that's even showed that poor sleepers, this is research by Dr. Moldovsky, one of the grandfather of sleep medicine in Canada, who mentored both of us and got us both interested in sleep. He found that in veterans who had poor sleep prior to even getting into the military were more likely to develop PTSD. So this is why it's so important that you find out from your patients and your clients if there was sleep dysregulating dating back to young age, or in utero if there was trauma to the mother, and then there was high cortisol and adrenaline release. This is already presetting the brain not to sleep well, even in infants and in utero stages. So this is why it's so important. And not only that, we know that if a person does not get good sleep for weeks, days, months, this affects the immune system, and we get more inflammatory factors being released. So there's more inflammation in the body when a person doesn't sleep properly. And then that inflammation eventually creates aches and pains, neck, shoulders, back, feet. I'm sure you've heard of fibromyalgia or some of the chronic pain syndromes that many of the traumatized people that we help have. And that is in part also because they haven't gotten the deep sleep for weeks, months, years, decades for some of them, especially if the trauma was at a very young age. So we're just referring to you on this slide back to chapter 1 that describes just how healthy sleep heals, and in so many ways. It also affects metabolism. And this is a really good book here, Why We Sleep, by Matthew Walker, that you might also want as a reference. So with disruption of normal sleep, as we've studied now with DBR, the locus coeruleus really comes online, and then there's this whole activation of the arousal center, of the brainstem, of the autonomic nervous system, and there's a release of noradrenaline up into the cortex, so the brain won't turn off. So if you look at sleep, if you think of the autonomic nervous system, the on system, which is the fight, flight, or freeze system, and the off system, which is the parasympathetic nervous system, the off, relax and restore. When you have a traumatized brain, either they have problems getting to sleep and or staying asleep and or waking up too early. So this on system, the sympathetic nervous system and the brainstem are overactivated. They're glitchy. They keep on turning on. There's too much sympathetic drive. So as we deal with the patients and as we work with them with their brainstem and autonomic nervous system, we're really trying to boost the off system, the parasympathetic nervous system. And the beauty of this is when they go through therapy, we can show them with the sleep studies how their sleep quality eventually gets to improve and how there is more parasympathetic nervous tone. And I've had many of my clients say to me, oh my goodness, doctor, it really is to do with the connections in my brain. It's not something wrong with me. I'm not lacking somehow. I say, no, this is your brain's reaction to extreme situations, and it tries to stay on to save your life because it's on lookout for danger. It's not letting you go into the deep sleep. It's not letting you stay in REM sleep. It's fragmenting deep sleep and REM. And so our patients wind up with all these nighttime problems, with nightmares, night terrors, sleepwalking, somnambulism, because in REM sleep, your body's supposed to be paralyzed. Just your heart is beating, your diaphragm moving, and your eyes are moving. You're not supposed to be acting out your dreams in any ways, but sometimes the sympathetic overdrive, the arousal system is so hyper aroused that it makes people act out their dreams, which can be dangerous. Also, if you're not sleeping well enough, you're going to have problems with depression, and there are also cardiac rhythm disorders. But a big focus of Jaan's work is with sleep apnea. And whenever the oxygen goes down at night, you block your airway with sleep apnea, the oxygen goes down. That sends an alarm danger signal to the brain that sets the sympathetic nervous system, the on system, again in overdrive. So if you're not treating the sleep apnea, or you're not getting your patients to go see a sleep specialist, the sleep apnea in itself is re-traumatizing, is rekindling that on system at night. So you're missing a whole part of your trauma treatment by not focusing on sleep and only focusing on the day. So we're encouraging you to come and learn with us to treat trauma on a 24-hour schedule, because as we stabilize the autonomic nervous system at night and get them sleeping more deeply, this really helps improve the outcomes for your trauma patients. And there in the slide, you'll see some of the references in the pages and the tables you can go to for a bit more information on this.
Okay, so thank you, Celeste. So I'm sure all of you now are maybe, hopefully, understanding the importance of tuning in to sleep, although you may be feeling a little bit overwhelmed with all of the different ways in which sleep can be disturbed, as on the previous slide. So this is where I think our book can be of great help to you, because what we've tried to do is to boil down our combined, I think, 60 years of experience in dealing with and working with people with sleep problems to an overview that captures what you have to do. And so we call this approach the four enemies approach. Why? Because it's not just a single thing often that is wrong with the sleep. Sometimes there's one, two, three, or even four different things happening all at the same time. So we'd like everyone to understand that when the person tells you, I'm having terrible sleep, that your mind should go to, okay, how many of the four enemies of sleep may be responsible for this person's difficulty? So, what are the four enemies? Well, the first is sleep apnea. Basically, our body, every cell in our body needs oxygen. If it does not have oxygen for 5 or 10 minutes, the cell is going to start to die. And so, any time that your body is deprived of oxygen, it is causing a problem. So, in the chapter in chapters 2 and 6 of the book, we give you tools to screen for, is there a possibility this person may have apnea? And then what do I do? So we talk about all of the things that are important to understand and do. The second possible way that sleep is disrupted is that the person does not have a regular sleep wake rhythm. They don't go to bed at the same time at night. They don't wake up in the morning at the same time. And because of that, the brain really doesn't know what the heck is going on and when it should start its cycle of maintenance that it needs to do. And so we give you a number of questionnaires that help you understand, is the reason the person's sleep is disrupted, is it because of their sleep times? Is it because they're having nightmares? Is it because of insomnia? All of those things are covered. And we also explain to you how a sleep diary can be really helpful in figuring all of that out. A third area that is really important in trauma was highlighted initially by Bessel van der Kolk in his wonderful book, The Body Keeps the Score. And truly, in trauma, the body does keep the score. Most people with trauma have just a range of different physical challenges and difficulties. And the fourth area that's really important for dealing with trauma is autonomic dysregulation. And so, what we go into great detail on is how you can go about re regulating that autonomic system. As Celeste said, boosting that parasympathetic system. And we talk in the book about using breathing. First of all, assessing whether the person is a shallow breather or a diaphragmatic breather, and then what you can do to teach them how to manage those that nervous system in a more effective way. Central to this, what we write about in the book, and what is now emerging as our understanding of insomnia and fragmented sleep, is the work of a very influential Dutch researcher, Joos van Solmeren is his name, and he published this review in 2021. In it, he made the point that insomnia is actually not a sleep disorder. It is a disorder of hyperarousal. And central to that is the activity of the locus coeruleus, which we highlighted in a previous slide. And the locus coeruleus is the center of that shock alarm system, which, for those of you who have been studying Frank Corrigan's deep brain reorienting work, is core to creating distress in not only the body, but also in activating cognitive arousal. So what it does when the locus coeruleus is active through the middle of the night, it prevents restorative REM sleep. You'll see the diagram here of the brains that are asleep. The top panel shows you a healthy sleeper who's getting a restorative night of REM. And during that period of REM, their brain processes an emotional problem. So in the research that he did, they gave people a task of singing karaoke.
Oh, I think Jan.
Were embarrassed.
Jan,
We're getting close.
can you go back to the karaoke thing?
You froze for a second, Jaan.
Yeah.
Oh, okay, yes. So I'm just describing what the brains on this slide represent. That the top row is a normal or healthy brain sleeping through the night, and then the one below it is someone with insomnia. And all of the people in the study were given a task of singing karaoke, and they were embarrassed about their performance. So that's kind of it's a painful, humiliating experience. So it activates your emotional system. And then they allowed them to sleep. And in the morning, they retested them to see did they start to deal with the situation better. And they found that those who had healthy, normal sleep actually recovered from the emotional distress, whereas those who had insomnia, their REM system was not working and they were still very agitated about what had happened. So that's the difficulty, is that this locus coeruleus is taking offline your normal adaptive process where you process the emotions and feelings and challenges that you had the previous day and teaches the brain how to manage them. But as somebody with trauma and insomnia, that does not work. They're not using the REM system effectively. So earlier I quoted this study, so I'm just going to go over a couple of their findings. This is literally published this year, so it's hot off the press. It is our current understanding of what REM sleep does for you. And so they said that although sleep is usually viewed as just a symptom, meaning if you have bad sleep, okay, that's something I could improve or work on. So that's being a sleep disturbance. But what the authors are pointing out is it's increasingly recognized that sleep has bidirectional influence over mental health, meaning that if sleep is good, it actually promotes health and wellness and emotional regulation. When sleep is bad, it is persisting, it is keeping you stuck in that negative state. So that's a very important idea, that it's much more than just a problem to deal with. It is something to encourage and enhance in all of us because it helps you. It's essential for maintaining emotional balance, reactivity, consolidation of emotional information, and reconsolidation of memories, particularly any negative ones. And during healthy REM sleep, it's the silencing of that locus coeruleus that allows for the timeout, which then allows plasticity in the amygdala circuits and for you to learn from the emotional experiences that you've gone through. And poor sleep, and especially chronically poor sleep, is going to exacerbate emotional dysregulation. And also for patients who are suicidal or have suicidal tendencies, it has been shown through research that that aggravates those episodes, particularly in those who are depressed. So, as we said earlier, improving sleep through targeted interventions is an important part of trauma treatment. So, what can we point you to help you in learning more and becoming more effective as therapists? Well, there's certainly the book, and we encourage you to buy it. It is kind of like a Bible of information, our combined understanding, Celeste and mine. But there's a website, Putting Trauma to Sleep, that's meant both for patients who may want to know more about what's going on and why is sleep important to them. So you can direct them to the site. So on the left panel, that they would click on the entering the patient area. And the right panel, it's for health professionals working with patients. So in addition to the website, we also are running a series of boot camps, meaning half-day training sessions where everything that's in the book is kind of packaged and delivered, and we show you, walk you through how to use the questionnaires, how to understand the relevance of apnea to the work that you do, the importance of screening for it, what to how you can speak to your patients and clients about it. And also, we go into how we use breath work in the work that we do. So, all of these things are covered in the boot camp. So, to conclude, just a quote from Noam Chomsky. I really love this quote. Truth is not a gift bestowed upon you, it is a personal discovery that demands your own effort. And I know all of you, as seasoned trauma therapists, understand that what you've learned through the years has come through personal discovery. And we encourage you to add to all the work that you've already done and what you've learned the importance of sleep in working with those who come to see you to improve their health status. So, I hope we finished on time.
Time is always there. It's good. You needed to say this. Thank you, Rianne. Thank you, Celeste. That was a lot of things. And I know you could talk about this for hours. It's so interesting. Thank you.